Today we will talk about the 4 steps for the surgical resection of meningioma. First, devascularization. Early control of the tumor's arterial supply, usually achieved by coagulation of the dural attachment and the feeding arterial branches, thereby reducing intraoperative bleeding. Second, detachment of the dural origin. This step consists of separating the meningioma from its dural base of attachment after devascularization, facilitating tumor mobilization. The third step is debulking, which consists of reducing the tumor volume and its mass effect, allowing better manipulation and decreasing traction on adjacent neurovascular structures. The fourth step is dissection. Dissection consists of the careful separation of the tumor from adjacent structures, brain, cranial nerves, and vessels, respecting arachnoid planes and preserving critical structures. In summary, the 4 main steps of meningioma resection are devascularization, detachment, debulking, and dissection. In some cases, partial tumor dissection may be performed before devascularization. In certain situations, tumor volume reduction, debulking, can be carried out before the other steps.